all across America and around the world. This is Veterans Radio. This is Veterans Radio.
Good day. I'm Jim Fausone. I'm the officer of the deck today here on Veterans Radio, and thanks for joining us. We've got some interesting stories for you. We always want to remind you you can find more about Veterans Radio at its Facebook site or at the web, veteransradio.org, where we're on the web 24/7. You can find a lot of our podcasts there as well. We post new ones every Tuesday, so you can get a new story, a new interview, something you didn't know before by going to veteransradio.org. And before we get started, we want to thank our sponsors. First up, we want to thank Legal Help for Veterans. Legal Help for Veterans fights for veterans' disability rights all across the nation. You can reach them at 800-693-4800 or on the web at legalhelpforveterans.com. We just want to remind you that Veterans Radio podcasts are available on all your favorite streaming platforms, including RSS.com, Apple Podcasts, Spotify, YouTube Podcasts, iHeartRadio, and Rees Across America Radio. So wherever you are, you can find us, whether it's on your mobile phone or your computer or your laptop, your tablet. But listen in to Veterans Radio Podcasts. We post something new every week, and you're going to find it informative. We want to welcome to Veterans Radio today Dr. Elizabeth Swenor, who's going to talk to us about health care and your own personal health. So first, let's just say hi to Dr. Swenor.
Hello, everyone out there, and thank you very much, Jim, for having me on today.
We're glad to have this conversation. It's very topical. It kind of first hit my radar reading a military.com article back in April about VAs giving GLP1 drugs to veterans for weight loss now. And then I started bumping into veterans who say, oh yeah, I've been prescribed it, it's helping. But it's part of a larger story. But before we set that up, let me mention that the doc here has been a physician for over 25 years. We're not going to give specific dates, but just know that this is somebody who's been around the medical block. Her practice focuses on functional medicine. We're going to talk about that, holistic healthcare and lifestyle medicine as part of this discussion. You have advanced certifications in metabolic and nutritional medicine, also certification in anti-aging, regenerative, and functional medicine by the American Academy of Anti-Aging Medicine, from the American College of Lifestyle Medicine certifications. I think you're Family Medicine Board certified. I mean, I could read the list on and on, but we'd never have any time for our discussion. So, but I want our veteran radio listeners to know that we're talking to somebody who's really concentrated her focus in the practice of medicine to help individuals and help individuals have better lifestyles. But as I mentioned, and the doc and I have talked a little bit about GLP-1s and weight loss and how that is such at the moment, a dynamic and changing environment that veterans need to have some understanding of. As I mentioned, there's been this article by military.com talking about all the areas VA is utilizing GLP-1s in. And I was really surprised that they were doing these studies, some in Colorado, some in California, some in St. Louis, and they've been publishing in the medical journals different results, 10% body weight loss, measurable improvements in BMI, blood pressure, LDL, cholesterol, all those kinds of things. These are studies in the Journal of General Internal Medicine. Another one which was posted in medical journals about 40% of the veterans enrolled in VA healthcare are obese. I was also surprised to find out the Department of Defense says roughly 67% of active duty troops they consider overweight. So weight and healthcare, which tie together, It's really a very timely issue. And I don't know that there's anybody who's really an expert yet in how all GLP-1 works. And we're not giving medical advice today, are we, Doc? We're just kind of talking about the concept of weight loss and how it impacts health. And maybe that's the place to start. If you can give us some of your experiences, how weight, obesity, and those factors go into overall health.
Well, first of all, thank you for the warm welcome. And it's very nice to be here today and have the opportunity to speak with everyone. And so GLP-1s, just to clarify, are FDA approved for obstructive sleep apnea, chronic kidney disease, obesity, and type 2 diabetes. So those are all FDA indications that your providers can prescribe them for. And of course, they're being used off-label here and there. But the biggest one that I think that really has moved the topic of obesity within the population is obesity. And thank you for sharing those statistics. Those are staggering statistics of the amount of human lives that are experiencing obesity. And obesity is a clinical diagnosis for a chronic disease, clinical diagnosis. For those of you that might be older on this call, harken back 15 so years ago, obesity was not considered a diagnosis in a chronic disease, and it's now considered a very multifaceted chronic disease that requires a multidisciplinary team to help the individual to achieve their optimal weight, as well as their, decreasing the disease burden. Because obesity increases the risk of diabetes, it increases the risk of cancer, it increases the risk of joint issues over the long run, cardiovascular disease, stroke, heart disease, etc. So there's a lot that goes into obesity. And again, it's multifaceted and really requires a team that really focuses on all the manifestations that might be causing you to be experiencing, this chronic disease. So my specialty is lifestyle and functional medicine. So lifestyle is addressing the pillars of your life, your habits. That's nutrition, sleep, exercise, stress management, abstinence from risky substances such as tobacco, alcohol, drug use, etc., as well as surrounding yourself by healthy relationships. That's what lifestyle medicine focuses on. Functional medicine is a much broader, deeper dive. It focuses on metabolic function, systemic chronic inflammation, the mind, gut microbiome. You may have heard that about that. I mean, that seems to be really much in mainstream now, gut microbiome. And the interrelationships of how all your systems in your body work together to either create disease, prevent disease, or reverse disease. And you can reverse diabetes, you can reverse obesity. You have tools in your tool chest that you might not even know that you have to be able to reverse these chronic disease. And the one we're focusing on today is obesity.
I really think that for most veterans, who are mostly men, roughly 80% of veterans are men, you're using language that we never even thought about. We never thought about how all these things factor into the next healthcare crisis we're going to experience. And certainly when we were in service, there was nobody at the chow hall who was thinking about, well, maybe I shouldn't load up that much starch on my plate, or and God help us if I had to eat MREs, meals ready to eat, for so many days in a row on the field. It really, I hate to say this is a new area, but it's not just nutrition. It is kind of a new area. Can you explain that a little bit?
Yes. Are you talking about lifestyle or functional or both?
Lifestyle, really.
Yeah. So one's lifestyle choices can, again, either reduce the burden of disease, reverse it, or prevent it. 40% of cancer comes from poor lifestyle choices, and 80%, and obesity is one of these chronic diseases, 80% of chronic diseases come from poor lifestyle choices. And you bring up an excellent point, Jim, and thanks for doing that. Really recognizing and respecting the environment that the soldier or the veteran is in. And as they move through their commitment, military commitment, they are hyper focused on whatever their duties are. And food is almost ancillary. You go to the mess hall, you get your food, and away you go, and you're back onto your your duties. And there's a tremendous amount of stress that goes along with that commitment to your country and your duties. And again, these lifestyle choices, I mean, you probably don't even have time unless you're in boot camp to get up and run, 5 miles before you get your job started. And certainly, again, not counting calories or looking what's on your plate at the mess hall because you're just eating whatever's given to you. So we do know now that food is medicine. And you can think of it as that. Whatever goes into your body has a message, and the message, you can break it down into two components. Either the message is, I'm here to help you, I can keep you healthy, I can prevent diabetes, I can prevent obesity, or the food is saying, highly inflammatory messaging. I'm going to initiate insulin resistance that then can go on to be diabetes. I'm going to initiate an adiposity metabolic syndrome. What that all means is this fat disruption of how your adipose, which is fat tissue, is regulated and metabolized in the body, which is a message that all goes through the liver. Your food can tell your body to say, hey, go dysregulate this. Or the food can say, hey, let's protect what we have and let's move forward. And then now, even to complicate health even more, is this gut microbiome that I mentioned earlier. So we know that the gut microbiome is involved in most of chronic disease, autoimmune diseases, some cancers. These are bacteria. 99% of the genetic information that makes a human is not human. It actually belongs to the genetic information of the gut microbiome. And you have microbes, healthy, friendly microbes, most of us. They live all over your skin. They live in every organ. They live in your nose. But most of what we're talking about is what lives in the intestinal tract. And 99% of the genetic makeup of you is not human. Only 1% of you genetically is human. So there's this phenomenal, awesome communication that goes on between the human body, your information, and the information from the gut microbiome. And I want to make this point, a really big point today. Those microbiome that live in your gut that are dictating your health and your projection of your health, guess what? They're 100% reliant on what it is you're putting in your mouth. And you can feed them, again, healthy foods or dysregulatory foods. And guess what they want to eat? They want to eat fiber. And where is fiber found? It's only found in plants. So we recommend predominantly a plant-based diet. I didn't say all, I said predominantly plant-based diet, a diet that avoids ultra-processed foods, that's pop and candy and potato chips and snack foods, which, by the way, are engineered in a factory to be highly addictive. That's why you want them all the time. And eating mostly plants and minimizing animal-based foods. We could really get into the protein synthesis of breaking down animal-based foods and how the microbiome spits out inflammatory byproducts from that, but I think that's beyond our conversation today.
Well, and we said at the outset, you could really get geeky, medically geeky on GLP1s and how all this works in the body, but nobody'd understand it who's listening. Our veteran radio listeners and their friends and family would go, I don't get that. I think the message we're trying to get across is you've got to take maybe better care of your lifestyle to have better health. And I want to go back to a phrase you used, which is poor lifestyle choices. Some of us know what those might mean, like I shouldn't drink too much or I shouldn't do this. But I also think there's generations of, oh, I didn't know that was a poor lifestyle choice. It's just a lifestyle choice to me. It's now been recognized as a poor lifestyle choice. And how do people begin moving away and making better lifestyle choices? That maybe is where the question goes.
Oh, thank you for calling that out. So back to these pillars. We talked about exercise and, harken back again, and not the too far off past. Your doctor would say, oh, eat right and exercise and you're going to lose weight. Well, first of all, what does eat right mean, right? And what does exercise mean? That's a relative statement or a relative comment that has different meaning to who's ever receiving it. I mean, exercise to some people might be, okay, I got up off the couch today and I walked around my house. I exercised. Someone else might think that that's, I have to go out and walk, etc. So exercise, that what is recommended by the CDC, our Centers for Disease government, is that we do approximately 150 minutes of exercise a week with moderate to high intensity. And the higher the intensity, the more it is associated with weight loss. So walking around the house for 5 minutes, I'm advocating any type of movement, but if it's associated and linked to the desire of losing weight, it needs to be more moderate to intense. Now, that again is a relative statement, dependent on the individual, because high intensity exercise for someone that may be in a wheelchair is going to be different than someone that's, able to walk fast around the block. So,
And we're talking to people of all different ages and physical conditions.
right,
So it really has to be individually tailored,
absolutely.
and that goes for all the lifestyle pillars, I suppose.
It absolutely does. Just an example, because I have several patients that are wheelchair bound, and we go through exercise programs of what can they do to get their heart rate up. And oh, by the way, it doesn't have to be 30 minutes or 150 minutes all in one block. It can be broken up 5 minutes here, 10 minutes there. It can be broken up throughout the day and piecemeal throughout the week to get to your 150 minutes. But some examples of things that we have done with wheelchair bound veterans would be to, if they're able to, exercise their upper body, light weights. And if you don't have weights, you can use soup cans, just something to keep the upper body moving, to build the muscle up above the head. And, are you able to do any twisting or side bending? Those are just some things just to get the heart rate up. And
There's another program that we I just saw them today on the streets. They were out walking at a local VA hospital. VA is adopting these principles, and they have a program called
Move, I think it's called Move VA or
Mo-
something like that.
yeah, something like that, or Get Fit or Go Fit. So if you're at a VA hospital getting your health care, you ought to be talking to them about, hey, what's another program that you might have that helps me get out and get a little more fit? Maybe, many of them have a gym program.
Yeah, I thought I had that written down somewhere. I'm sorry, I can't find it at the moment, but what the exact program is called. But yes,
GeoFit, yeah, I think it is. Again, many of us don't realize there's all these available resources to help us, but you have to kind of ask and want to be helped, don't you? Don't you find that with your patients until they come around to it? You're just talking in one ear, going out the other.
that's true. There needs to be a state of motivation.
Yeah, yeah. And your specialty, have you seen it become more accepted or more recognized over the last decade?
Yes, I personally have seen over 6,000 patients within my department. We've seen, this is over the past decade. We have a 6 to 9 month wait list, and we just need more doctors that are trained in this. It's really hard to keep up with demand, and unfortunately, the access for patients to get in to be seen is not ideal. It's not. There's a huge demand, and I'm excited about the demand because it's great to have this, and that patients are wanting to feel better, and the whole person or whole health concept is now really becoming more of a movement within healthcare systems across the nation. This whole person care means we look at the whole totality of you, which brought you here today with your chronic disease. How did you get here? And what is the interdisciplinary team that can work to help you to reduce this chronic inflammation or, disease burden. So to answer your question, this is a huge movement right now, and healthcare systems are trying to catch up, but these are very large healthcare organizations and nothing moves quickly. So,
Well, and I think one of the things that I guess I'm asking, but I'll state it more in my opinion, which is that, and I think this is true for veterans, but I think it's probably true for all patients. It's easy to get depressed. It's easy to say, I can't make any forward progress on this thing, and so I might as well stay on the couch.
no, I'm so glad you brought that up because that was actually my next topic I wanted to talk about. Trying to as I possibly can is the stress that experience during their training or their duties, etc., sets actually a metabolic pathway that significantly increases the risk for chronic disease later in life. And this is now just becoming recognized. And stress in particular, we're going back to that gut microbiome, the brain and the gut are intricately connected via a cranial nerve 12. It's called the vagus nerve. But it's like an elevator shaft. We have information going from the brain to the gut and gut to the brain. 95% of our mood hormone is made in the gut. 95%. So if you're taking an antidepressant, a lot of that drug is working in the gut, and many people get side effects of diarrhea, etc. But the stress component, the mental health, the mind-gut connection really needs to be looked at and continue to be looked at. We are learning so much every day in the field of medicine of how can we help individuals like veterans or individuals that have experienced significant trauma or even mild trauma. Even a divorce is trauma. That can set you up for inflammatory processes that can increase your risk for chronic disease. So how do we regulate brain health and gut health and manage our stress? Some simple things that individuals can do is just deep breathing. I talked about that vagus nerve. You can just if you're sitting on your couch, put the phone down, turn the TV off, close your eyes, and breathe in through your nose, hold it, and exhale out through your mouth. Do that for 5 minutes. It lowers the cortisol and the inflammatory responses in the body and does help with mood control. If you have problems with anxiety going to sleep at night, practice these deep breathing exercises. And there's a lot of YouTube videos out there that you can look up. It's yoga breathing or deep breathing or vagal, VAGAL breathing. That's the cranial nerve 12. That's something that everyone can simply do, and it's free.
Well, and one of the things too is you have to take some personal responsibility on your health. Veterans certainly should know that there's not a silver bullet. And this brings me back to GLP1. While VA is now prescribing more GLP1, while Medicare is launching a new GLP1 bridge program for Medicare Part D folks for weight loss to see how I guess research for the next year and a half or something. That's not going to be the magic bullet. It may help. It may get you over a hump. But veterans should know it's not a magic bullet. It's all those pieces that have to come together, doesn't it?
I think of it like a treasure chest. You have lots or a toolbox. You may have your favorite tool, which would be like a hammer. Okay, we're going to call that the GLP. But you can't build a house without the nails. You can't screw the screw in the wall without the screwdriver. There are many tools that we have in our personal tool chest that don't cost us any money to get. You can regulate your sleep, go to bed at the same time every night, get up at the same time every morning, turn off the phones 2 hours, the TV off before bedtime, read a book, do the deep breathing, stress management. Eating does cost money, but it's the what you're putting in your stomach that really matters. A high fiber diet, mostly plants, limited ultra processed foods. The exercise, again, costs you the energy. It's not going to cost you money. You just need to get up and move. And, and healthy relationships, hopefully that doesn't cost you money to have a friend and a family have a positive relationship with. So again, the GLPs are a tool to help with weight loss, but they are not the only thing. You really need to have a foundational healthy lifestyle in order to have sustained weight loss, because I'm sure you don't want to be on those drugs out the rest of your life. And another key important thing, just to shout out here, Jim, is that those individuals that are on GLPs are at high risk for muscle mass loss. This is where the exercise comes in. 40% to 60% of, up to 40 to 60% of the weight loss coming from muscle. And muscle is the key organ for longevity. You have to have muscle mass for longevity to live a long, healthy life. So that's another reason to get up and move and to make sure that you're eating right.
Well, there's a lot that can be unpacked there. We don't have time for it all, but we really do appreciate that Dr. Elizabeth Swenor, who has deep knowledge in these fields, can talk to us. And again, we're not giving medical advice. We're having a conversation about how to be the most healthy person you can be. The Army slogan used to be all you can be. Well, that's what we're sort of saying here is there's a way for you to take control of some of your health items and be all that you can be. So I really do appreciate the time you've given us today, Doc.
Oh, thank you, Jim, for the opportunity to speak to your audience. And I want to thank all those that are listening for their service. And I would be honored to come back sometime when you have another topic that we can chat about.
We'll do that. We'll unpack some more of these issues. We appreciate it. Thank you.
Thank you. Okay.
And I want to thank everybody for listening to Veterans Radio today. I am Jim Fausone. It's been a pleasure to be your host. I'm a veterans disability lawyer at Legal Help for Veterans, and you can reach us at 800-693-4800 or legalhelpforveterans.com on the web. You can follow Veterans Radio on Facebook and listen to its podcasts and internet radio shows by visiting us at veteransradio.org. That's veteransradio.org. We again want to thank our national sponsors, the National Veterans Business Development Council, nvbdc.org, Legal Help for Veterans, a veterans disability law firm with a national practice before the VA, can help you on your claims and your appeals. It can be reached at legalhelpforveterans.com or 1-800-693-4800. We also want to thank our local sponsors. This would include the Charles S. Kettles chapter of the Vietnam Veterans of America, that's chapter 310, VFW Graf O'Hara Post 423, the American Legion Irwin Preskin Post 46 in Ann Arbor as well, the VA Ann Arbor Healthcare System, and certainly the National Vietnam Veterans of America Association. You can be a sponsor by going to veteransradio.org, clicking on the About Us and our sponsors, and help us out. Keep this program alive for the 21 and 22 years. Keep us going for another 20. Thank you.